to the room, and then we'll get started. I'll first introduce myself. My name is Damilola Jolayemi from UCLA Center for HIV Identification, Prevention, and Treatment Services, and we have a great program planned today. I'm just the welcome person. I will introduce our facilitator soon. Thank you. Go ahead and share in the chat. We want this to be a very interactive discussion. So we want you to make use of the chat and share your comments, questions, and just any thoughts that you have through the session. Welcome, Dr. Shapta. I see your comment already. Okay, so the title of this seminar is Building the Resistance, the Impact of Systemic Racism and Mass Incarceration and HIV in Los Angeles County. Just wanted to share again, if folks have questions during the course of the presentation, please share it in the chat. There will be opportunity to ask questions and to report back from breakout rooms. I'm gonna go ahead and welcome or introduce our facilitator today, Dalia Felito, and Dalia will introduce themselves and go ahead and take us through the program, at least to a portion of it. Thank you, Dalia.
I'm not the main facilitator, I will note. There's going to be many of us, and I'm on a fantastic team. But my name is Dalia Ale-Ferlito, and on behalf of the HIV and Mass Incarceration Subcommittee of the CHIPTS Community Advisory Board, I'd like to welcome you to this conversation on the intersection of mass incarceration and HIV. We expect that opinions here will be reflective of the broader society and that there will be a variety of perspectives here with regard to the role of jails, police, and prisons, as well as how little or how much resources should be invested in these institutions. And we presume that there are people here who want to address mass incarceration and may not necessarily be abolitionists. And we are hoping to share ideas and address the issue collectively across various disciplines that have common cause. We know that a society in which people's needs go unmet is a society that produces the unhealthy outcomes that we see, whether it's homelessness or HIV or substance use or mental health issues. These are the byproducts of a society that isn't taking care of all of us. The question then becomes, what do we do about it? What are the solutions? And if we found solutions to address the houselessness crisis, for example, those are likely the same solutions that address HIV, that address mental health, that address substance use, and so forth. And in LA County, we've been seeing some movement, at least, toward investment in alternatives to incarceration by way of the Care First, Jails Last roadmap that was developed prior to the pandemic and lays out a plan to intervene with community services at different possible entry points before, during, and after a person touches into the criminal legal system. And the very recommendations considered are public health solutions to public health issues. And if you're here, then you probably know that comprehensive solutions beyond jails, police, and prisons are needed. And this is where you all come in. So this session is the first of a series of meetings planned to address the impact of mass incarceration on HIV by bringing together providers and activists and researchers and other stakeholders to discuss overlapping concerns and goals in the areas of HIV, of racial justice, the criminal legal system, and reentry services. And so as a brief reminder, I'm going to just go over quickly the objectives for today, which is to describe how incarceration and interactions with law enforcement impact HIV and sexually transmitted infection acquisition, risk, and treatment engagement, to develop recommendations for improving partnerships and service integration in order to increase HIV and STI prevention and testing and treatment engagement among people impacted by the criminal legal system, and reduce recidivism and improve diversion services for those affected by HIV, and to identify policy options and policy research priorities at the intersection of HIV and the criminal legal system. So again, this is the first of 3 LA County stakeholder meetings in which this is aimed to inform science and services and policy and advocacy related to the intersection of the epidemics of incarceration, HIV, and other STIs. And so we thank you so much for joining us today. And we want to hear a little bit from you all. So in the chat, if you can share a couple things, the first being one thing that you intend to get out of this seminar. And the second is list the communities that you are currently serving. We would love to hear from y'all. We've got a lot of people in this room. the Zoom room. So we got servicing spouse 6. What else? Who else is here? Who else is in the room with us? What do you intend to get out of today? Why'd you show up today? Out of all the things you could be doing on your lunch break, you decided to come here without a free lunch. So clearly you care. I mean, to meet people, to help improve care and linkage for incarcerated people. You're welcome as a HIV doc working with folks in the jails. Part of DHS, better understand the interactions with correctional health, more information on how community is being impacted, wanting to hear actionable items, get as much information as possible. Folks working at the Office of Diversion and Reentry, better understand the perspectives of activists and reentry providers, how to understand incarcerated folks, especially Latin and people of color, Latinx and people of color. All right, so we got folks who are coming from a lot of different places, a lot of different disciplines, a lot of areas that both intersect directly with HIV and with the carceral systems. We got folks serving Coachella Valley. All right, welcome. So without further ado, want to thank you, everybody. And please keep introducing yourself in the chat. Please let us know why you're here, why you care, why you showed up, and you're giving your time to this conversation today. And now I'm going to go ahead and turn it over to our panelists to take away this next portion of the conversation.
What's up, everybody? My name is Felipe, pronouns he, him. I'm a PA here in LA. I work at Watts Health Center. Really proud to be a part of this. Thank you, Dahlia, for that excellent introduction. Just kind of showing us all kind of why we're here. Hopefully folks aren't unfortunately not able to check the chat now, but hopefully a lot will come from this. Because, we have our work cut out for us. I think, for those of us who are, working in the HIV community, we know that EHE, right, ending the HIV epidemic is a real potential for us. And we have a lot of, biomedical tools. We even have a lot of political will and money, right, that kind of behind these efforts. And yet, one of the key drivers, as we'll sort of hopefully kind of lay out for you all, of the epidemic, particularly in this country, is sort of the process of sort of racist mass incarceration. And that includes policing, police violence, creating these unstable communities. And LA in particular has a unique history in being the largest jailer on the planet. And, outside of some organizations that are here today, thankfully we have Alfredito, who's here from La Defensa and Justice LA Coalition. There are organizations that have been, sort of trying to address this issue. But these two haven't merged just yet. And today is sort of one of the first, hopefully of many to come, and trying to sort of bridge these two fights, because each has sort of a rich history. Trying to advance the slides, and it's not letting me. Okay, there we go. So this is just a slide telling you all about CHIPTS and what CHIPTS stands for: Center for HIV Identification, Prevention, Treatment Services. Some of us here are on the Community Advisory Board. Others are researchers and policymakers as well. And we actually received a Kickstarter grant to help kind of fund some of these efforts. So feel free to kind of check back in and check the website about what CHIPTS is all about. So this here is a small statue in our lobby area for Watts Healthcare Corporation, where I work. And if you can see in this bottom portion, there's actually melted glass there. And this is melted glass from the Watts rebellions or the Watts uprisings, right? And I bring that up because, one, you'll see a lot of overlap to our current period, but the point is that Watts Health Center, like many other institutions, Martin Luther King Community Hospital, Charles Drew University, are a byproduct of these rebellions, right? Are a byproduct of primarily Black folks fighting against police violence, but also being angered around other issues, right? Not just police violence, but the housing, education, right? Access to healthcare being some of these issues as to why folks rebelled. And Watts Health Center is a byproduct of that resistance. So I think it's important for us to recognize that today, we do stand on the shoulders of giants, many giants often having no names right now that are in some of these images, and yet we have to thank them for their fight back. And it's directly connected to this movement today. We're kind of in the tail end of this movement, but it was sort of the largest mass movement in U.S. history, right? Millions, anywhere between 15 million and 25 million people were mobilized into the streets following the murders of George Floyd and Breonna Taylor, Ahmaud Arbery. All around the world, you can see here were hundreds of protests every day fighting against racist police violence. And of course, they took on a violent character, and I think that this picture, you can compare it to the Watts Rebellion, right? But it was a global movement, and I think it's important for us to recognize that the sort of justice that was received as it relates to Derek Chauvin being charged and prosecuted and found guilty has everything to do with, again, these unnamed folks out here in these streets fighting back. Because had it not been for that, the far majority of police don't face any consequences. And we may actually have some impacted families on this call. So just want to give a shout out to any impacted families that might be out here today. And then there was a sort of certain recognition that came out of this movement among healthcare providers. And I'm a healthcare provider, many of us on this call are healthcare providers, and folks showed up. Healthcare folks certainly showed up. A lot of it driven by this sort of connection between understanding the sort of syndemics, right? These dual pandemics of racist police violence and COVID-19, particularly the disparities around COVID-19 and its impact on Black and Brown and immigrant community, and in particularly those living with HIV in terms of disproportionate health impacts. Here in LA, I'm a member of Frontline Wellness Network, which is also a part of the Justice LA Coalition. And we organized a march. We had about 400 healthcare workers who protested on Men's Central Jail and called for its closure and part of the Care Not Cages. We'll talk about that later in the talk. But again, this recognition among healthcare workers that these struggles are connected. And I think, again, thinking about police violence, COVID-19, thinking about HIV in particular as being sort of this drawn out epidemic of 30 to 40 years that has disproportionate impact to folks of color, marginalized communities, LGBTQ folks, et cetera. And we'll talk about that the million folks that we've seen die of COVID-19 within a couple of years, you can see sort of drawn out over 30 to 40 years as it relates to the HIV pandemic. This is a slide talking about the connection between sort of police violence and sort of, and who's impacted. And I was sort of tangentially connected to this struggle in the American Public Health Association that talked about police violence as a public health issue. This was mainly born out of actually Ferguson and the murders of Mike Brown and the movement that followed that particular piece. But I just wanted to point out here about who are the folks that are disproportionately impacted by police violence. As you can see highlighted here, right, that the physical and psychological violence that is structurally mediated by the system of law enforcement results in death, injuries, traumas, and stress that disproportionately affect marginalized people, right, people of color, immigrants, folks experiencing houselessness, right, disabilities and the LGBTQ community, right, those with mental illness, those who use drugs and sex workers. In other words, these are our people, right, these are our community that is disproportionately impacted by police violence. And so we begin to see, again, why there's a connection here between policing, jails, prisons, and the HIV epidemic. So what particularly are the intersections? And we'll go into this in more depth here. I mean, first off, let's just compare sort of the US to the rest of the world, right? So per 100,000, on average, the US locks up about 639 people per 100,000. Right? And you can compare that to the rest of the world, and you can see that actually the US is by far leading the way. And here's a kind of a better look at that. if you compare it to sort of like Western industrialized countries, these are countries within NATO, you can see how the United States, right, far exceeds the next country in line, which is the UK, right, nearly 6 times that amount. And California alone is nearly 5 times the UK. So California, as I say, is thinking about, our own state. We can see that there's just record numbers of people that are locked in cages. And we have to sort of think about sort of the impact of that, right? So what does that mean for people's relationships? What does that mean for, people's homes? What does that mean for people's jobs? And all these sort of consequences to that. And when we look at it from sort of an ethnic, sort of racial, background, we can see that Black folks disproportionately, I mean, it's really an understatement, but Black folks are, nearly 6 times more likely to be incarcerated, right, than white counterparts, more than double, maybe more like 3 times as likely than our Latinx community. And so it's huge. But even if we looked at just sort of the white community by itself and compared it to the UK, right, you can still see that even white folks are nearly 4 times as much as sort of the next country in line, right, nearly 10 times for the Latinx, right? And if we think about sort of if Black people were their own country, right, I had to shrink the graph just to sort of make this point, right? Black folks are way off the scales here in terms of being disproportionately impacted by racist incarceration in this country. All right, so again, thinking about those consequences of being, locked up and how that impacts our health, right? So, how did we get here? And I think some of us know this history, right? I'm assuming here folks have seen the documentary 13, right? Maybe folks have read The New Jim Crow or at least heard about it. James Foreman's Locking Up Our Own is an interesting book as well. But just in these 3 images, you can sort of see the sort of overlap of the overseer and Black folks perpetually enslaved to this period down below with these young children, right, these young Black children who are incarcerated through the program of convict leasing, right, to sort of this current period, the sort of new Jim Crow period following the Civil Rights Movement. And this is sort of like a good depiction, shows the sort of roots of mass incarceration. And so much that we can sort of talk about here that I won't sort of belabor, but I think just briefly is that in the early 1600s, a decision was made, right? And legislation was passed called the Slave Codes, right? That codified what it meant to be Black, what it meant to be white, literally created race, right? Created the concept of race based on skin color, and created this sort of forced division with the sole purpose of wanting to make money. And then there were periods of rebellion that culminated in the Civil War that was also mainly about money. But in either case, after this period of a brief period of Reconstruction, within the 13th Amendment that freed the slaves from chattel slavery had built within it, as we know, the sort of caveat, right, the exception of punishment for a crime that legalized slavery in this country, right, or reincarceration, reenslavement through punishment. And then we have this period following the Civil Rights Movement where we have record numbers of folks in jails and in prisons. And I think it's important to note that during this entire time, there were rebellions, right? From the point of slavery to the point of the Civil War, there were over 250 rebellions that had happened against slavery. And so, in other words, this wasn't a passive acceptance of the process. There were fightbacks all along the way. We see pictures here of the Civil Rights Movement. There's also the Black Power movement that happened kind of following the Civil Rights. And of course, we have this sort of kind of current period we have in sort of post Breonna Taylor, George Floyd, et cetera, where millions of people have sort of taken to the street, right, in resistance to this. And, we commonly think of the federal laws, right? We commonly think about Nixon and Reagan, more commonly with the war on drugs. LBJ actually started it all in '65 with the war on crime as it relates to federal legislation, right? And, kind of to compare it to sort of the 13th Amendment, which in one amendment, there was the legislations on the one hand, free slaves, and at the exact same time, provide context for re-enslavement. Right, in 1965 was a passage of the Voting Rights Act, right? So you can see this sort of like a liberation type legislation. And in that exact same year, also same summer, was the passage of the War on Crime. And so you can kind of see again this sort of like dual process of kind of liberation and kind of doubling down on a process that would be essentially re-enslavement through incarceration. And then over the years, you can see again Nixon's war on drugs, the creation of the DEA, and then by the 70s, the prison population had already doubled again. 82, famous Reagan, the war on drugs. 86, of course, is the kind of the 100-to-1 thing about the crack laws, right? Where you need to have 100 times possession of crack for cocaine to get the same kind of punishment. So if you have 5 grams of crack, you get a mandatory 5 years minimum. You would have to have 100 times that in powder cocaine to get the same punishment. And so we know about powder being more of an affluent kind of drug versus the accessibility of crack. And by 1990, and this is one of the key points here, by 1990, we already knew that 1 in 4 Black men were incarcerated and behind bars, right? Or even on parole. And that still didn't stop the crime bill of 94 under Bill Clinton. That in this time period, following the 3 strikes law, the prison population would double again. And so you can see this graph just skyrocketing following the mid 70s here. And I wanted to add this piece here. This is here 1975-ish. It's sort of the time frame in which we think the virus first entered the United States, whether it was through Haiti and blood transfusions, sort of debate about that exact entrance piece. But the point is, it starts to enter the community right around the time of racist mass incarceration. So, taking a quick look at the current situation, we have about 2 million people roughly behind bars, right? Whether it be in a state prison or local jail or federal prisons. You can see kind of off to the right, this sort of sliver here includes the number of youth. 36,000 youth are in cages. Because you see 32,000 folks are in immigration detention centers. And all in all, this is a kind of snapshot of the number of folks at any given moment in the year that are in cages. But what's important here, though, is that as it relates to jails, and thinking about LA in particular, right, is that while there is, about 500,000 people in jails right now, that because of the sort of churn, the in and out of jails, right, spending a couple of days, a couple months, in and out, et cetera, that there are actually more than 10 million folks, right, who are in and out of jail that are impacted, right? So if you, in other words, in a year's time, if you lined up buses filled with people from New York to San Francisco, that would be sort of what the number of people impacted by jails looks like, okay, in any typical year. And so again, thinking about what happens to, your rent, what happens to your relationship, right, with your partner, what happens to your children, right, your job. And so you can see the just massive destabilizing effect of 10 million people over the course of a year. Again, as we know, disproportionately Black, Latinx, marginalized communities like LGBTQ folks, the unhoused, those with mental illness, et cetera, right, are disproportionately impacted this way. And if you can look to the right here, that circle, right, I talked about the roughly 2 million people in cages. That's still only about a third, right, of the overall number of people, about 7 million people who are trapped within this so-called justice system. So thinking about the 840,000 people who are on parole, more than 3.6 million people on probation, right? So that means, how is that affected their employment status, right? What is their housing situation, right, regarding this, right? And so again, these sort of taking the full picture of again how incarceration, the policing, in and out of these systems impact folks' lives. In LA, you can see on the left, this is out of the LA County Alternatives Incarceration Report that we'll hear more about. But I just kind of wanted to read this quote out of this document, which is based on the book City of Inmates by Kelly Lato Hernandez. Right. So Los Angeles County operates the largest jail system in the United States, which imprisons more people than any other nation on earth. According to the Vera Institute, no local jurisdictions in the world incarcerates more people than Los Angeles. If so, Los Angeles, the city of angels, is in fact the city of inmates, right? The carceral capital of the world. And, you know, so we have a unique situation here in LA that we have to be talking about policing incarceration as it relates to the epidemic. And you know, we know obviously folks voted yesterday, so we know that the question of housing, the question of crime, right, was one of the topics or you know, political points that folks are interested in. So I think it's, you know, it's sort of imperative for us to start thinking about doing something different, right, than what came prior. And I say that because when we look at this period of the civil rights movement and what followed, right, I think it's important to remember that it wasn't just the Nixons and the Reagans, right, and the Republicans that drove mass incarceration. And it wasn't even mainly federal laws. It was local and state laws that were in large part advocated for and carried out by the new civil rights leaders that became politicians, whether it be the DC City Council, Mayor of Atlanta, Mayor of Los Angeles, you know, DC, et cetera, right? There were all these new wave of Detroit, these new wave politicians that had to sort of address sort of dual issues, right? On the one hand, there were these sort of social determinants that we know of, right? Inadequate housing, right? Inadequate, you know, paying jobs, access to adequate health care and education, right? There are these sort of like what we call these like kind of public health or social services. And then there was this sort of aspect of quote unquote crime that was also going on within the Black community. And so, you know, so it created a challenge. And in some ways, these folks who were on the one hand leading the resistance actually were part of what drove, you know, this period of mass incarceration that we're in right. So I wanted to read this actually from this article called The Real Roots of the 70s Drug Laws. And it's also based on this book, Locking Up Our Own. The new Jim Crow, while partially born out of the racist backlash against the civil rights movement, this is too convenient a narrative. It erases the crucial role that African Americans themselves played in the development of the current criminal justice system. It is in part the unintended consequence, right? I think this is important, the unintended consequence of African Americans' own hard-fought battle against crime and violence inside their communities. To ignore that history is to disregard the agency of Black people and minimize the grievances, and in my opinion, to emphasize to risk making the same mistake again. Because here we are, we're asking these same kinds of questions, right? In this period of the pandemic and post-pandemic, there's been more and more talk about crime, more and more talk about houselessness, right? And there's been this punitive approach. The city council recently voted to increase the LAPD budget, right, which already is bloated in half the LA city budget, right? So there is a still kind of similar approach. So I think what folks are advocating today, at least some of us are advocating, is to not do a yes to public health and social services and yes to punishment, but to sort of say yes to public health and social services and no, right, to the funding of policing and incarceration. And we'll talk some more about that.
Yeah, okay. I was going to say we've gone over time, so do you want me to go ahead? Okay. Great. Thank you so much for setting us up and setting the stage. I've given much of that lecture before, and it's hard for me to hear or give actually, because it's so painful. My name is Dr. Naina Harawa. I'm a professor at UCLA and Charles Drew University. I'm also the head of the Policy Impact Core for CHIPTS, and this is one of the areas in which we really like to see impacts on policy. Next slide. Or my pronouns are she, her. Flip the next slide. Uh-oh, there we go. So I want to start with one of the points that Felipe made a little bit ago, which is the high rates of incarceration we have, period, but then especially among Black men. And part of what that has contributed to is a factor that affects risk for HIV in Black communities, but also other communities as well. There was a report done by the New York Times a few years ago in which they literally documented the fact that Black men are literally missing from our population, both because of incarceration, but also because of high levels of premature death. And so you can see on this slide areas where that factor is larger than others. And so the areas in orange and yellow are areas in which Black men make up less than 50% of Black adults. And you can see it's heavily in the South, heavily in the areas that were affected by slavery. And so this puts relationships and in terms of, relationships in a very challenging position. Next slide. These are also, we argue, not inconsequently, some of the areas where we see the highest rates of HIV in the country. So these are rates of people living with HIV with darker colors being higher rates. You see that in California, but you also see it very much in the South and Southeast. Next slide. So researchers have looked at these patterns and come to the conclusion that American prisons play a central role in the HIV epidemic among Black people, and that we're really in a setting in which we have these overlapping epidemics, mass incarceration, HIV and AIDS, and substance use, and then the war against substance use being part of that picture. Next slide. And you can see over this time period, over the time period where mass incarceration really took off, you also see a rise in the proportion of people living with HIV or AIDS who are Black or Latino. And so that's gone from less than 30% for each population, less than 30 and about 15% for Latinos in 1985, to 44% for Black people and about over 20% for Latinos in 2017. I want to make the point that most of this association is not about what goes on in prisons. It's about the fact that so many people are taken out of communities and the impact that has on the status of those communities and on relationships. So I outlined some of this here. I'm rushing to make sure that our next speaker can talk, but you can see that you can imagine how in communities where Black men are disproportionately taken out of those communities, that affects both heterosexual relationships and gay and bisexual male relationships. And so there's this disruption, there's less opportunities for partners, and that leads to increases in sexual risk, which then contributes to higher rates of HIV and STIs and larger disparities. And this is for communities that are affected regardless. We're just making the point that Black communities are highly affected and Latino communities are disproportionately affected. Of course, for individuals who experience incarceration, there's a huge stigma and potential for economic marginalization that occurs among those individuals. It has all kinds of impacts after people leave, including decreases in people's opportunities for jobs, for education, for access to housing and services. And those too are things that increase the likelihood that people will engage in behaviors that increase their risk of either transmitting or acquiring HIV, and that also decrease their likelihood of accessing treatment for HIV or prevention. Next slide. Even though this is not a focus of our talk, I think it's really important that we point out that both detention and deportation are part of this system, are part of the carceral state, both because they are among those people who are in detention, obviously are part of those who are incarcerated at any given time, but also because our criminal legal system and its laws often lead to deportation, whether that's for very minor crimes that people may have often have already served their time for, or for unfair application of laws around of laws that unfairly impacts people who are undocumented. It also takes individuals out of sexual partnerships, out of families, causing huge disruptions. And one of the things we've seen in particular for undocumented women in some cases is that they may struggle more to leave a relationship that's abusive, or conversely, maybe call law enforcement in a dangerous situation because they're concerned about deportation of their partner, or because they can't leave their partner because of their own legal status. And so there's this overlap between domestic violence and HIV risk, and this is one of the ways in which women who are undocumented may be particularly vulnerable. I think I'm going to skip the rest of the slides and just go to the last one that talks about Los Angeles and HIV. Here I summarize a lot of the points that I just made about, actually I'll leave this one up for a hot second, that cause or lead to that relationship between mass incarceration and the HIV epidemic. It's not the only factor, but there's strong evidence that there's many ways in which it contributes to risk. And Felipe already made many of the other points that I was going to make here, which is, and you can keep going, Felipe, which is that other populations that we serve and that are vulnerable are also at increased risk of incarceration, whether people who with mental illness or people who use substances, as just a couple examples. We also see overlap in Los Angeles between areas in which there's high levels of jail bookings and areas where there are high rates of HIV. You can skip to the next slide. And so this is a distribution of people living with HIV. And I think I'm going to stop there and just go on, because we want to really hear next about solutions as well as having time for discussion. And so I'm sorry to have rushed through parts of this, but I'm happy to turn this presentation over to Yvette Ale-Ferlito, who's going to talk about calls to action.
Thank you so much. Hi, everyone. Yvette Ale-Ferlito, pronouns they, them. I'm the co-founder, executive director of La Defensa, a member of the Justice LA Coalition, also a county commissioner. So I'm very familiar with some of the county representatives on this call in your departments. I serve on the PSRT, the Public Safety Realignment Team, and the Gender Responsive Advisory Committee, as well as the pre-trial work group. I really want to take a moment to just ground us in the words of Mariam Kaba, who tells us cages confine people, not the conditions that facilitate their harms or the mentalities that perpetuate violence. I really want to invite you all to challenge the way that we're thinking about public safety and the current responses that really lean on incarceration and policing as the avenues for public safety, and really reframe and reimagine justice under these principles that responding to harm without creating more harm, transforming the conditions that lead to harm, applying public health approaches to public safety, building community-based systems of care, and rejecting the victim-perpetrator binary and recognition that we all experience and cause harm are really the principles that are guiding the care first vision that the community really envisions for our county. Slide, please. We understand that these issues, as previous speakers have been talking about, are intersectional, and that really organizing at the intersection of public health, racial justice, movements against incarceration and policing, gender justice are really important as stepping stones towards having holistic solutions to the problems of incarceration, the AIDS epidemic, as well as other social issues, lack of access to mental health care, lack of housing, that are really destabilizing families and communities. And it behooves AIDS activists, public health associations, and criminal justice reform activists to really work together to find those solutions. Next slide. So new strategies on HIV care and prevention really seek new funding by defunding systems of punishment and of systemic racism that are key drivers of the HIV epidemic, as the previous speakers have really beautifully outlined. A commitment to being disruptively innovative with new and expanded interventions and policies, and ensuring transparency and accountability. This is really important because there have been a lot of great policies that have been passed in the last few years, but the implementation piece is key. So we need accountability from all partners and lifting up voices of communities most impacted by HIV, and I would say most impacted by the intersections of HIV and incarceration. Next slide. So Justice LA is a coalition that was founded in 2017, and it's a partnership between grassroots organizations, organizers, advocates, and impacted communities. And by impacted communities, I mean folks that are formerly incarcerated, currently incarcerated, the children of those that are incarcerated, like myself, folks that have been criminalized, folks that have been on probation and parole. And our three goals were to stop jail expansion, reduce the footprint of incarceration, and reinvest dollars away from the carceral system into community-led alternatives to incarceration. Next slide. And we're grounded in abolitionist principles. Justice LA prioritizes intersectional movement building and really center those that are most impacted by a variety of systemic harms, including folks that are Black, Brown, and Indigenous, folks with disabilities, folks with mental health needs, substance use, folks that are part of the LGBTQ+ community and Two-Spirit community, that are those that are most impacted by these intersecting issues. Next slide. It's important, as we've learned in the presentation today, to really learn from our histories and those that have been at the forefront of those intersections. And when we look back at history, we can look back to Stonewall. We can look at Marsha P. Johnson and Sylvia Rivera, who were activists for trans liberation, for sex workers, folks that have been leading the work around HIV, that understood those intersections. And really it's the folks that have been at the margins, that have been most impacted, that have been at the forefront of innovative solutions. Next slide. And learning from those histories, it's important to also take a look at the solutions that have been already in place. The county has the solutions written and prepared. There was allusion to the Alternatives to Incarceration Work Group final report. So this was a report that has been written. It's already in the county's hot little hands, and it was a year-long process, a partnership between the community and the county. The county formed a work group to write these recommendations that focus on diversion from jails, diversion into community-based services. 114 recommendations were passed and adopted, which has been the guiding light for the county's Care First vision. Next slide. And this came off the heels of stopping the jail expansion plan. So one of the goals of the Justice LA Coalition is to stop jail expansion. The county had a $3.5 billion jail expansion plan. We defeated that. And that opened up the door to be able to start the drafting of the recommendations on alternatives. And part of that victory was also freeing up dollars to be invested into care. And so part of the recommendation implementations is actually not just implementing the policies, but funding the policies that have been recommended. Next slide, please. Part of getting that funding was Reimagine LA and the Measure J ballot initiative. In 2020, a lot of us organizers understood that although the county had adopted the recommendations, we needed money to actually implement it. And so myself, Unices Hernandez, now council member Unices Hernandez, and United Way, and many other partners on the ground, we came together and we drafted Measure J and we passed it in 2020. And what it does is it secures 10% of locally generated revenue for alternatives to incarceration, for community investments, for small business support. So these are dollars that can be used towards the solution. The first year of implementation was $100 million. This year it's $200 million. Next year, we hope it exceeds $300 million and gets closer to $900 million. Next slide. But after many years of talk, the county stopped the jail expansion plan, adopted the Care First vision, is implementing Measure J, or now known as Care First Community Investment. There has been little progress to actually close Men's Central Jail. So again, going back to Justice LA's mission, one of our goals is to reduce the footprint of incarceration. So not just stop jail expansion, not just support services, but actually close a jail, Men's Central Jail. Next slide, please. we see that this past year, we have record numbers of deaths within the jail system, 55 deaths, when in 2016, we had a record low of 20. So we've more than doubled in the last few years in terms of deaths. And we know that confining people in cages actually exacerbates health conditions, including mental health, and suicide is one of the leading causes of death within prisons and jails. Next slide. So we've launched a campaign to close Men's Central Jail, and we have the outline, we have the roadmap to close Men's Central Jail within the Alternatives to Incarceration Workgroup final report. Next slide. And here's a snapshot of some of the recommendations. So one of the key recommendations is pretrial release and diversion services. Nearly half of the jail system is pretrial. And what that means is that folks have not been convicted. They are legally innocent. They have not had their day in court, but they either cannot afford money bail or a judge is preventatively detaining them because they're seen as a risk. And these risks are determined through algorithms. An algorithm, much like a credit score that looks at someone's age, whether they're employed, what their housing status is, to determine whether someone should be released or confined. And again, these are legally innocent people. And so the report really outlines the type of model that LA County should be implementing that focuses on needs and strength assessment rather than risk assessment, that really holds the presumption of release, that supports services, that provides services like return to court, text message reminders, childcare, connection to health services to really help stabilize an individual and support them to return to court. Next slide, please. We're also seeing that health workers, folks that are working day in and day out with people that are incarcerated, are speaking out about the conditions. The conditions inside of the jail, like I mentioned earlier, are perpetuating death and perpetuating harm. And those are just the deaths within the jails. We don't have accurate numbers around the long-lasting impact on people's health once they're released from jail. Next slide. So our three demands now are to set a timeline to close Men's Central Jail, to allocate $230 million to build 3,600 community mental health beds, much like what the Office of Diversion and Reentry is already doing and doing very successfully, and to set up an independent pretrial services agency within 6 months. We've been successful in moving the county to create an independent pretrial services agency, but the implementation process, like all implementation processes, are not moving at the pace of the problem. So we really are focusing on these three demands. Next slide. And for folks that want to participate in the coalition, we have healthcare workers that have been critically engaged in our work since our inception. Felipe mentioned Frontline Wellness Network. It was the clinicians, the ER doctors, the healthcare workers at Frontline Wellness Network that help us defeat the jail expansion plan in 2019. And it's healthcare workers that really have provided a very important voice in moving the county in the right direction. Folks that understand their clients and their clients' needs have a huge impact. And so you can participate by signing up for our mailing list and starting to plug into our meetings. We have monthly coalition meetings. We have a virtual action network where we provide text messages twice a week if folks want to take action, whether it's writing to the Board of Supervisors, making calls, joining for a rally. There are many opportunities to participate. Next slide, please. And then if you want to be involved through the Frontline Wellness Network and Dignity and Power Now, you can just text Health Justice to 213-463-6287. And you can plug into the list and you can be involved. Thank you.
Thank you for the great presentation. We're going to go ahead and have our speakers do a Q&A session. So we're going to have our speakers go ahead and we'll spotlight all of them. And then if you have any questions, feel free to raise your hand. We will unmute you. Please keep all questions to about 30 seconds or less if possible, so we can get as many questions as we can in the next 5 to 10 minutes. So does anybody have any questions for our speakers today?
There was one question in the chat about
Okay.
the school to prison pipeline, and Dr. Shabda, you're very right. That's another way that people are funneled into incarceration, and we know that that's a racially biased process, that boys of color in particular, are more likely to get suspended, punished, and then in some way potentially incarcerated or on a path that sort of points them in the direction of incarceration. Then our girls, that are white kids in general, in the school system, even for very similar types of infractions. And I think maybe most of you who are parents may have observed that. I've certainly observed it within my school system. And yes, it disproportionately affects girls of color as well. So yes, that's certainly a part of the process.
Thank you for the answer. Do we have any more questions? Feel free to share in the chat as well. I see Dr. Shabda raised hand, so go ahead and unmute yourself and ask your question.
So great presentation. I also know from LA County data that kids who are picked up, who are treated for marijuana misuse or marijuana use disorder are more likely to be Black African American compared to other groups. Along the line of the school to prison pathway, is there thinking about like how relationships with LAPD, Sheriff's Office, and kids from Black African American communities can be altered so that we're not picking up our youth and sending them to places for treatment, when in fact it's probably much more disciplinary in terms of behavior problems that the police are picking up?
Yeah, I think this is a great question. The demands from young people, particularly from groups like Student Deserve, is to actually remove law enforcement from school campuses, because the best way to stop negative interactions between law enforcement and young people is to remove law enforcement from the spaces where young people congregate. And when it comes to, you know, this idea of like community policing, like we need a better relationships with law enforcement, and that's actually going to keep us safer. In fact, LA has implemented community policing for a very long time, and that has actually not had a positive impact in terms of a reduction in criminalization of Black and Brown communities.
Any additional questions or comments from our panelists?
One thing I would add, just from a quick plug for the Gender Responsive Advisory Committee, we released a report in November of 2020. It's also known as the GRAC, and it really specifies the needs of gender marginalized people within the system. And of course, we know that there's a very deep intersection between gender marginalization, rates of HIV, and criminalization. And one nugget that I will leave with folks, you know, we talked about disproportionality of Black communities in the jail system. You know, there are 8% of the population, around 30% of the jail population. But the Black population within the K6G unit, that's the LGBTQ plus quote unquote units within the jails, that's 40%. The largest disproportionate representation of Black people are within the LGBTQ plus community. And so when we're thinking about all of those various intersections, you see it in the data. You see it in the data of the jail system. And Black women in particular serve the longest sentences across gender and race. So they serve longer times than all other populations of women and all other populations of men. And so it's important to look at that data, because 50 years ago, there wasn't a single cis woman in 3/4 of the jail systems in the country. And now they're the fastest growing population within the jail system.
Thank you, Yvette, for those extra comments, additional comments. Are there any questions before we go into breakout rooms? Do we have any more comments, Felipe, Nina, any additional comments?
There was a great question here, and I would love maybe Felipe to answer it as
Oh,
a
I see.
provider. What healthcare providers can do outside of the clinic, and I assume maybe even within the clinics as well, to resist incarceration of patients. And I want to, I'll point to a resource in the chat that has information about that, and also about understanding what the rights of prisoners are if you see prisoners being taken into your clinics or space or emergency rooms. And a lot of providers aren't aware of those, so I'll share that. But go ahead, Felipe.
Yeah, I mean, I think, I mean, to me, the main one is outside of the clinic. I think, connecting to these broader struggles, so I think what they presented regarding, the sort of, movement to close mid-century jail regarding sort of the history of sort of, folks going out in the streets. I mean, I do think that in many ways it's that sort of visible presence outside of the exam room that actually really sets the example. Within the clinic, though, I mean, I know some folks in my job did log in. So is talking with coworkers about this issue as well and sharing it within, and because to me it's that sort of the missing piece mainly is healthcare folks involved with quote unquote activists, right? Is to see this as sort of the same fight and seeing our purpose being more than just connecting to resources, which we should be doing, and giving them the right kinds of medications and caring for them, but it's also what we do outside of the exam.
Yes, and there's an opportunity tomorrow at 9:30 a.m. in front of the Inmate Reception Center. We're rallying and hosting a press conference to highlight the harm inside of the Inmate Reception Center and Men's Central Jail and demand the closure of MCJ. So Inmate Reception Center, 9:30 tomorrow. Feel free to come.
Thank you, Felipe and Yvette. And I see another question that may have been missed, and I'll go ahead and read it out. Is there some way, I'm sorry, 1 second. What about changing medical leadership at Men's Central Jail? Is there some way that more caring medical care is delivered there? Anyone want to take that question?
We get this question a lot. Why don't we just invest more money and expand care within the jails? That will actually solve the problem. Well, when you look back at history, Twin Towers that was built in the early 90s was pitched as a better jail, a more state-of-the-art jail that will actually help people. And in fact, it's just another dilapidated jail today that's harming people. And so the solution isn't necessarily better care or investing more resources within the jail. The fastest way to actually improve people's health and access to health is actually to bring them home and to provide healthcare in their communities. That's not to say that harm reduction is important, right? People should have access to the care that they need, and community-based organizations should have more access to their community members within jail. But the best way to improve health conditions is to just let people go home and provide them the care that they need.
Thank you all. I don't know if I missed any other questions in the chat, but we're going to go ahead and open breakout rooms, and we'll have more opportunities for discussion. And so before we open the breakout rooms, we're going to have 5 breakout rooms and roughly about 18 participants, 16 to 18 participants per room. I don't know if everybody can see my screen, but these are the discussion prompts that we'll be discussing. So different breakout rooms will discuss different prompts. Once the breakout rooms open, you will be automatically funneled into a virtual breakout room, and then you would have a facilitator in there.